shared last year that the grant has been renewed through 2013. Wow. Yes, applaud yourselves, pat yourselves on the back. They wouldn't renew anything unless it was meaningful and it was moving science forward and it was making a difference. And so you need to applaud yourselves that all the hard work you put in this is definitely making a difference to our understanding and hopefully the future of HD. And the first 3-year grant was funded at $1.6 million a year. The next 4-year grant was funded at $3.5 million a year. And now this 5-year grant has been funded at $5.6 million a year. And you know that's because we're sending every participant all around the world. We have to reimburse them for their travel and their time and their MRI scans and the staff that you work with. So it's great that NIH is supporting these efforts, and I'll share with you now some of the data that we're getting. And I also have to say that this study couldn't have come as off as well or as quickly without also the support of CHDI. So just continue to thank them for their presence in our HD research lives and their ability to facilitate moving research forward. Why do we do the Predict HD study? We set it up to recruit persons who had already, through their own initiative, gone to receive a genetic test to see whether they had the CAG expansion in the HD gene. We were interested in recruiting these individuals to see if we could see what you've told us all along, is that HD begins long before the neurologist is telling you it begins. And this study is one that you started. The families came to us and said, these are the things you need to look at. And so part of the study is, when should treatment begin? Should it begin when you get a motor diagnosis, or should it begin when you, the families, have been telling us, no, something's different now? And so one of the things that we really want to address is, when should any treatment begin once we have that treatment? Secondly, how many participants are needed if we're going to start testing different treatments for Huntington's disease? And thirdly, how are we going to know if it's working? Because if we could start the treatment earlier, maybe we could put off losing jobs, or put off having to give up your favorite bicycling activity, or being able to still take care of your children or do your finances longer. And in this case, if we find a treatment that works, it actually would put off when you hit this diagnostic threshold. So this whole thing was put together from an initiation by you, and this is one of our first publications about the study, is in Archives of Neurology in 2006. So this is the motto that you taught me, is that instead of get well soon, you would prefer stay healthier longer.